Greetings, everyone, and welcome back. You are now tuned in to Get Expanded's live discussion. For those joining us for the first time, Get Expanded's mission is to help bridge the gap between patients and providers by making it easier to access trusted information and connect with professionals in airway health, jaw development, and expansion-based treatments. We do this by hosting these live discussions and Q&As with experts in the field while also building the Get Expanded directory to help patients find providers and best suit their needs. So today, we're joined by our special guest, Dr. Jeremy Manuele, also known as Dr. J, who specializes in advanced expansion techniques such as MARPE and FME. And the conversation will be led by our host, GirlJaw, a patient advocate and passionate voice in this space who shares her own expansion journey to help educate and support others. Be sure to connect with both Dr. Jeremy Manuele and GirlJaw. Their information will be linked in the description box below. Towards the end of the discussion, we'll wrap up with a live Q&A, so drop your questions in the chat as we go. And with that, GirlJaw, let's get into it. What are some of the key topics or questions we'll be covering with Dr. J today?
Well, yeah. What are we covering today, Dr. J?
Well, we can start out. We have we wanted to do a little bit of an FME survivor guide, and
Perfect.
you learn a lot as a doctor, but in some ways you learn even more as a patient. So going through the experience myself, there's been a few things that have been super helpful, and so we can talk a little bit about that, and then there's a few other things I want to detail out. So I traced out some images to kind of help paint a better picture of what that expansion process looks like. Because typically, any types of progress records we get are usually spread out pretty far. But since I'm going through the process myself, I can kind of take a look at other time points, and we can kind of see what information we can glean from that. So yeah, I will show you guys some
Hey, real
things.
quick.
Yeah.
Yeah, real quick before we get into it. So, just before we started, you were telling me about you're all numb on your upper lip and your top teeth. You just came from a procedure. Tell everybody what that procedure is.
Yeah.
What's it for?
So, yeah, so there's a procedure called micro osteoperforations, or something that it's kind of the acronym is MOPs, and that's what it stands for. And essentially, it works off of the same physiology that SFOT works off. Now, SFOT is much more aggressive and thorough, requires flaps. There's grafting involved typically, but the MOPS procedure is a fairly straightforward and simple procedure. And essentially, for lack of a better description, what it is any place that you want tooth movement to speed up. You want the roots of the teeth to be able to move faster through the bone of the teeth. You essentially provide a small insult to that bone, or a small perforation to that bone. So the way that that looks, they have devices that they sell that actually are made specifically for that, and it is basically like a little screw, and you screw it in and then you unscrew it. Um, and there's different ways to do that, but essentially that's the gist of it. It creates a small hole in the bone, and what happens is it triggers the body to repair that area of bone. But instead of just bringing the cells to that immediate area, which may be, a millimeter, a millimeter and a half wide, this assault to the bone, the area around the bone, those cells are brought to that entire area a couple millimeters away from where the assault is as well. So what it essentially equates to is that bone tends to soften for about 6 months or so, and during the time that that bone is a little bit softer, the roots are able to more easily move through that space. So in my case, I have my diastema. I want to keep expanding. I really don't want a bigger gap than I already have. And so, we're doing micro perforations to soften the bone in the front here, so that as I'm wearing my aligners, I can get through them a little faster. And, the idea is I can close that diastema a little bit earlier than I otherwise would be able to. And so this is something that we routinely offer to our patients, and some are like, "Yeah, let's do it," and others are like, "Wait, you're gonna do what?" So, so
So
it really, yeah,
it's like
yeah,
surgically
it's optional.
facilitated
Yeah,
orthodontic therapy, but like the mini version without the
yeah,
bone
the
graft.
mini version, yeah, you're not put to sleep. I mean, it's just local numbing, and it's usually very area specific, right? So, like, it's not going around all the teeth. Although you could, it would just take a long time. Usually it's going to be in the area where you want the movement to enhance the most.
So for you, it would just be in the anterior portion right
Yeah.
now?
Yeah. For me, basically canine to canine, from the front part of the canines in between all the roots, just in that front area,
So
so
you're
that we can.
essentially going, like, up here, right? In between each tooth root,
Yep.
doing
Yep. You got.
your
Yep.
micro perforation just so people see. And then is it much like a corticopuncture, like back in the day, when you guys did that? It's so you don't, like you said, you don't have to flap down the gum, you go right through the gum and through the
Correct.
bone at the
Yeah,
same
and
time?
yeah, and so, the in my opinion, one of the more effective ways to do it is with an actual kind of screw type device. Some practitioners, and even in other circumstances, I'll do it this way as well. You can use like an instrument on a high speed, right? So you can just puncture the bone that way. It doesn't typically go as deep when you do it that way. Whereas with the screw, it can go a little bit further. So there's multiple ways to do it. But the theory is the same. It's essentially, you're providing a small insult to the bone, which causes the healing cells to come there and repair that area, but also softens the bone around it. So yeah.
Yeah, somebody gave me an analogy of it's like when you jackhammer the cement and you're softening up that little section. It's the same kind of concept. You're not
Yeah,
really jackhammering, but you're softening up that same supporting
that's right.
structure. Yeah.
Yeah.
All right. So yeah, I'm excited to see what your FME survival thing is. Should we get
Well,
into that?
let's take a look. All right.
I just
So
want to say real quickly, don't mean to cut you off. We have some comments
yeah.
even here. People saying that you're looking good with the gap and your cheekbones are popping. So there's that for you.
Let's go. Yeah, well, my upper lip is kind of numb right now, so if my smile looks a little funny, that's probably what it is. Is that it's still it's still numb. So yeah, no worries there. All right, so let's talk about one of the things that was most difficult for me, and this kind of shows the FME and how it's placed and what it looks like. So, one of the things that a lot of patients struggle with, myself included, initially a lot, and still to some extent now, is the FME design is such that it's off the palate to a certain extent, and what that does is it creates that negative space underneath there. And that negative space can be challenging for a number of reasons. So one reason is that, when you swallow, either food or water or saliva can be stuck underneath there, and that is a weird feeling to get used to. So before I knew any remedies for this, like, it was just a different feeling. I'd swallow, and then I felt like almost immediately I needed to swallow again because there was saliva trapped under there, and it's like you can never really clear it all. Additionally, when you're eating, there are so many little places where food can go, and you're spending an hour at night trying to just clean out everything, and then even then you're like, did I get it? Like, I'm not really sure. It's very difficult. I have not found any amazing or wonderful brushes. I did order the ones you recommended, Taylor, but like I have not found any amazing proxy brushes that actually clean that out completely and thoroughly. And so what I've done is I found a combination of jawline gum that works really well to actually seal off the area, and I'll show you what that looks like. But there's challenges with making sure this is just right. So first off, if you were to use like regular chewing gum, it's super soft, right? So it's gonna, the gum itself will stick everywhere, and it's so soft that when you eat food, the food mixes with the gum, and then it totally defeats the purpose. Now, this gum is a little bit too hard. It's hard to form. And this one is a little bit too soft. Like, it forms fine, but then you have some of the problems you would have like with regular chewing gum. This one's also very brittle. So as soon as you pull on it, it tends to snap instead of like being elastic where you can continue to pull it out. Whereas this one is very elastic. So what I've discovered is the combination of the ultra hard jawliner gum and this Feline gum. If you have like one piece of each and you chew them together, you can have a consistency that is malleable, so you can cover the entire expander. But it's elastic enough that when you go to take it off at night to clean everything, it tends to come out in one piece. Even the portions that are kind of stuck up underneath the hardware, if you kind of work it out slowly, it's almost like spaghetti. It'll just keep coming and coming until it's gone. And so this has been a game changer for a couple of reasons. So one thing it does is like I mentioned, make it easier to clean afterwards, because instead of letting the food get all up underneath here, you're preventing the vast majority of the food from ever being able to go underneath the expander. The other thing it does is it really helps with the ability to speak. And so speech is difficult when air is traveling underneath the expander. Like the words are much more difficult to say. So when you have, and this is just an example, the whole entire FME covered, this area kind of acts almost like a tori. So some people have tori on the roof of their mouth, and it's essentially extra bone in that area. And so that, they learn to speak, they learn to eat, like everything is fine. You would never know unless they showed you. So basically what the gum is doing is kind of providing a barrier and just covering the whole entire thing, and it can stay on all day. And then at night, when you go to brush your teeth really well, you can take it off and clean underneath the expander, and it takes a lot less time. So you can kind of experiment. If somebody comes up with an even better combination that they like, the other nice thing is that this gum tastes terrible. It actually, it really doesn't taste like anything. It's kind of just like plasticky taste. This has a nice taste to it. So using that in combination, it's a pleasant flavor throughout the day as well. So that's good. Um, and then this is the only other thing that I wanted to show you guys. A lot of patients have trouble, especially with the stretching turns when they are doing the turns. So it's kind of hard to get a feel for this, but some of the things you want to make sure, one, you want to make sure that the key is exactly in the middle. And then you want to be able to support the turning of the key in a way that while you're pushing, it's not going to slip and like kind of like fall back or shoot back a little bit. So for forward turns, and you can kind of see the short part of the wrench will be forward or toward the back, and then we're unturning right now, and you can see how I'm using my thumb to kind of pull forward to gain enough pressure to unturn those turns. And so again, from the front, when you're doing your forward turns, the short part of the wrench is heading toward the back. And then when you switch that around in order to do the unturns, if you're doing stretching turns, you can use your thumb to kind of support the movement to pull the key forward again without like trying to pull really hard where it can potentially slip out or something like that. And then the last thing I wanted to go over with you guys, I just got word that they are redesigning a new key, which I'm excited about. So these keys will be available hopefully sometime soon. And what these are is they're offset by about 30 degrees on either side. So the original key and the one they're still using is this one here that has a swivel and then it has a straight end on the other side. One of the challenges is, the swivel end is sometimes difficult to generate enough force in order to do an effective stretching turn without feeling like you're losing control of the screw. And, you start to worry like, am I going to slip and is it going to, jab me or something like that? Whereas with this key, which was a one-sided key that they were using for maybe a month or two, this was okay, but it was difficult to undo the turns because of the way that it was designed. And so they're coming out with this screw or wrench, which will allow people to be able to use either side. So no matter what orientation the screw is in, as you're turning it, it will allow the wrench to be able to engage some part of the screw and complete the turns. So that should be nice. And then also it's long enough that you can generate a little bit more force. You obviously don't want to generate too much force, but you want to be able to generate enough in a more comfortable way without having to put all that pressure on that small lever arm. So that's those things. Now, the last thing I wanted to share with you guys today, actually a couple more things, and this will get into what we'll talk about with expansion. So one of the main reasons that people seek out expansion, myself included, is nasal breathing. And one of the questions they always have for me is, if I expand, am I going to be able to breathe better, and am I going to be able to sleep better? So the first question is much easier to answer. Almost always with expansion, and I'll show you why, you're going to have a decrease in nasal resistance, and it's going to be easier to breathe. So that half of the equation is quite easy. But will you be able to sleep better? Sleep is multifactorial, right? And if you have UARS or sleep apnea, that there's a lot that could be going on other than nasal breathing that's contributing to that. And quite honestly, there usually is more going on than nasal breathing. But one of the things you can do to try and see if your sleep will improve with expansion is to do nasal dilation prior and just see how much benefit you get from that. So there are many different kinds of nasal dilators, and I've used pretty much all of them, at least that I know of. Started out way back in the day with Breathe Right, then did nasal cones, which I used for a number of years. But the challenge with those is that the internal dilators, especially when you sleep, they can tend to tear up the nose a little bit. And so, like, you move or something, and then it scratches the inside of the nose and it's uncomfortable. And the fact that it's an internal dilator, the device itself is actually blocking some of the benefit you would get because the device has to be inside the nose. So this is the one that I use the most. And if you haven't seen it or tried it, it's pretty awesome. And what it does is you have these little metal dots, and you can position the metal dot wherever you need to on the nose. Could be more forward, could be more backward, could be lower, could be higher, wherever the major constriction is. And really, it's just trial and error. So you can put them different places and try different sizes here, and it allows you to pinpoint exactly where the nasal constriction is. And then these are little rigid bars with magnets on them. And so when you put this rigid bar close to it, it kind of pulls, as you can see here, it pulls the nostrils outward and opens up the nasal passageways. And then depending on what you're doing, you can have a different size for making sure that at the end of the day it's effective, and it's you're actually being able to breathe. So I'll use these even when I run and exercise in order to be able to have nasal breathing while I exercise. And then I use them when I sleep. So this is a superimposition, and some of you may have seen these. We do these on our live or our consultations, our online consultations for patients who have questions about their expansion when they're going through the expansion process. Or if we ever want to check in and see what has happened with expansion, you can do what's called a 3D superimposition. And so basically what this is this is an image, actually two images that are stitched together. And what it does is it shows the difference between whatever you want to look at. In this case, it's the upper jaw and the 10 tads, which you can see right there at different time points. And so this is my superimposition from the initial placement of the FME to about 2 weeks ago, which was about 6 weeks into my treatment process completely. And it allows us to measure the quantity and the quality of expansion. And so when we look here, you can see, like, as the suture splits, you can have an idea of how much is the front part of the jaw expanding compared to the back part of the jaw. These are the pterygoid plates. How much are those displacing? And so it allows us to really understand what movements are happening and how symmetric the expansion is. And so, one of the questions I get all the time is, how much will expansion improve my nasal breathing? Like if I only need, let's say, 2 millimeters of expansion or 3 millimeters of expansion, like is it worth doing an expander in order to obtain that much expansion? And I'll tell you, like, I was pretty skeptical of patients who would tell me after 1 or 2 millimeters of expansion, like, I've already noticed a huge breathing difference. Like, I can already breathe through my nose so much better. And I'm like, really? Like, you've really only expanded like a millimeter, like a millimeter and a half. And I'll show you, though, this is interesting because I traced it out in a certain way, and we'll get to it. But I was shocked at how much of an anatomical difference in the nasal passageway specifically there was, at least in my case, with about 1 millimeter of expansion, which you see here. So before we get to that, I'll show you a couple other views. So this is the view of the FME. So you can kind of see the FME turning as the bones are moving. Now, there's always going to be a little bit of play in the system, so to speak. So if you were to measure out how much this FME has moved compared to how much the bone has moved, I'm sure that the FME has moved more than the bone. But that's okay. What we are worried about and what we want to pay attention to is how much overall total movement has occurred within the jaw, and what the quality of that movement is, like the front part of the jaw compared to the back part of the jaw, and the top part of the jaw compared to the bottom part, or the top part of the nasal passageway compared to the bottom part. So this is what that looks like from a transverse standpoint here. Again, you can see all the things that happen with typical expansion. You can see the bone getting wider. You can quantify that and see, like, how much one side is expanding compared to the other. These are the cheekbones, so you can look at those as well and see how much movement, if any, you have of those. And then, of course, you can see the displacement of the maxillary sinus And as we go along, you'll start to see even some slight rotation of the orbital bone as well. And of course, as the bones are moving outward, you're going to see those teeth move along with them. This is the forward movement of the jaw. So, of course, the neck back here is moving. That's just a difference in head position between the two images. So you can kind of ignore that. But looking here, you can see how much forward movement and how much inferior movement that the jaw and the teeth have had within that amount of expansion. So, in this case, the forward downward movement not too high, which makes sense because we've only expanded about a millimeter, but it is quantifiable. You can see that downward forward movement of the jaw, which we expect with all expansion or all skeletal expansion. Now, this is the view again that kind of surprised me the most. So this is the right and the left external nasal valve. So essentially, we're taking a section right here. So this is right where the air goes in, and you can see in my case, like the left side of the nose was definitely more constricted. But even with 1 millimeter of expansion, you can see how much wider open that external nasal passageway and valve is. And so, like, I was almost when I was experiencing better breathing, I'm like, I almost thought I was in my own head. I'm like, am I really like? I mean, I feel like I can breathe better through my nose, but yeah, I wasn't able to really quantify it. And then when I was able to trace this out and look at it, I'm like, wow, that actually makes sense. And so we'll see, to be continued as the expansion process continues to unfold. I'll update these images and we'll kind of see how much of a difference there is. What I would say that in general is that patients typically report the most improvement in nasal breathing within the first like 4 millimeters of expansion, and then it tends to plateau a little bit more. So we'll see. I've been pleasantly surprised that even with 1 millimeter of expansion, there's already been noticeable changes within those nasal valves. And here's a view of the more internal area here. So you can see on this side, this is where the cross section is taken right here. And this is what you're looking at. So you can see again, both sides, this is the jaw that's widening here. So as those bones move apart, both sides of the nasal passageways are opening. And so that change in nasal breathing and that ability to breathe better through the nose happens much faster than I realized prior to going through this on my own. And then this last image was just to kind of give you guys an inside view of what happens with the device itself. So these are the pins that you're looking at. We're going to look at all 5 sets of pins, right? So some of the pins may have more displacement or movement than others. In general, and ideally, of course, these would always be parallel. But, and these ones, like in this section, that looks pretty parallel. But sometimes you will have a tad that, isn't quite as parallel and it may drag a little bit. Those ones look pretty good as well as we move more interiorly. But it is kind of fun to see like what actually happens to the device. You can see that one on the right side of the screen, which is one of the left TADs. You can see there at the end that had a little bit more wobble or displacement, being a longer TAD there. You can kind of see it, drag and tip a little bit there. So that was all the fun stuff for that I had for today. So yeah, let's talk about whatever you guys want to talk about based on that.
Yeah, well,
Yeah,
okay,
well,
that's a really neat hold on. I'm getting feedback. Hold on one second. That's a really neat discovery you made with the jaw gum.
Yeah,
You're using it to plug up the device so that you can
right.
eat. And you're saying that it stays in place while you eat and makes obviously not getting food in the device so much easier. That's just kind of genius.
No, it's been great. Yeah, and then also, the FME in general is a little smoother, more comfortable, not as many sharp edges as a custom RP, but still, I mean, there are corners, right? And if you're trained to have good tongue position, you have your tongue on the roof of your mouth, so it's constantly pushing against the device, and it can definitely, irritate the tongue. At least it has with mine, and so having that gum cover that helps with the irritation as well, and then of course with speech as well.
That's also a really good point because a lot of times I hear of patients complaining generally in that first week or two
Mhm.
of the adjustment period on the tongue. And there's that RPE guide guard that is sold on Amazon, just like a really flimsy
The wax
kind
one,
of
yeah,
plastic device and doesn't work very well. This is way better of a recommendation. So thanks for sharing that because I
of
never
course.
thought about it. Almost works like Gishigu a little bit,
Right, right,
like
yeah.
just like a
Yep.
larger.
Yep.
Yeah, that's so cool. And then also to check back in with, so you were saying you were skeptical about people wanting or reporting nasal breathing benefits within the first 1 to 2 millimeters, but you're saying that you got your nasal breathing benefits already happening, and you're only
Absolutely.
1 millimeter.
Yeah, yeah, and at first it was just like, man, like I just feel like I can breathe through my nose better. And the best way to describe it so far is like, when your nasal breathing tends to be like the best it's ever been, like that starts to become normal, right? So hopefully it'll be better than it's ever been at some point. But like for me right now, it's like, man, like the best that it's ever been, like that is becoming more than normal. And then I hope as I continue to expand, like it'll be even better than I've ever experienced. But like that's where I'm at right now. Yeah.
Yeah, and those intake nasal dilators are my favorite. I've tried all of them. And like you said, those ones that you put inside the nasal cavity, it hurts. It actually kind of like can rip up the delicate skin on the inside. So I love the intake ones. And we had somebody in chat saying they had tried it and it still doesn't really make much of a change because I believe what they're saying is they're so congested. And
Yeah.
I had the same thing happen. It wasn't until expansion that now I'm actually able to wear them comfortably and I can wear them at night with mouth tape. But before expansion, if I try to wear those at night, it didn't really fully well work. And if I wore mouth tape, oh my gosh, I didn't because I would have just like choked. So
Yep.
um,
Yep. And
expansion makes a huge difference with those.
yeah, it's a really good point. And here's the thing. I mean, so there's kind of three parts to nasal breathing. The two we looked at, right? External nasal valve, internal nasal valve, but then there's the entire turbinate system, right? And the internal nasal cavity, right? From the nasal aperture and inward. And that portion of the nasal passageway is very much determined by inflammation, truthfully. So when you have congestion or inflammation for any reason, regardless of how much anatomy you have, it can overwhelm the system. So you could have the biggest nasal passageway ever, but either allergies or sickness or there's different things that can cause that entire passageway to swell up. So, with nasal breathing in general, Mother Nature's afferent, Mother Nature's way of clearing out the nasal passageway so that there is no congestion is nasal breathing over time. And nitric oxide is added to the sinuses, which then is breathed in and out through the nose. And when you're doing that consistently over time, at least a period of 1 to 2 weeks, you should experience a reduction in inflammation. Now, if you can never get to the point where you can tolerate breathing in and out through your nose all day and all night, because of whatever it may be, anatomical or the allergies are so bad. If you can never get on the other good side of that, then yeah, you're not going to experience that relief of those internal nasal passageways, and you're going to be constantly battling the congestion. And that's where something like expansion can often get you over that hump to
Mhm.
where you can tolerate it, and then you can nasal breathe, and then that soft tissue inflammation can be resolved long term. But if you don't nasal breathe after expansion, you might end up exactly the same place where you started. Is like, hey, I did expansion, I could breathe well. Oh, but now I can't again. And if that's the case, it probably means that one of a few things. There may be some severe, allergic whatever that might be going on, or you might not have ever converted fully to nasal breathing. And so, in cases like that, it really is important whether it's additional dilation or lip taping. It's important to make sure that that nasal breathing is happening both day and night.
100%. And with like to further on that, the nights, so I basically wear my mouth tape, my nasal dilators every night. But some nights I'm too tired or I'm traveling and I just don't have the equipment on me. And the nights in which I wear the nasal dilators, the whole thing, I breathe through my nose more the next day. And so it's like it's a training of the whole entire like neurological system, it almost feels like,
Yep.
to
Yep.
do it. And then the nights where I don't actually wear them, then I'm mouth breathing more that day. So it's quite an interesting link.
Yeah. No, I used to wake up congested almost every morning, like and before I discovered nasal breathing, lip tape, any of that stuff. Like, I would just sleep like anybody else. And, you wake up and you've been mouth breathing at night and, your throat might be dry. But really like congestion was the number one thing. So, even before expansion, I mean, I've been lip taping and nasal dilating for years, just to manage the inflammation side of it. And thankfully, my nasal passageways weren't so small that I couldn't tolerate that. But certainly now that they're widening up a little bit, it's much more pleasant. So yeah.
Well, awesome. Is there anything else about so wait, how long have you been expanding for now? Like 2 months?
Yeah, almost 2 months. So, yeah, the
Okay.
beginning you were yeah, about 2 months. Well, so the first 3 weeks, I wasn't really doing forward turns, but, so I've been expanding for a little over a month. Yeah.
So when you say you weren't doing forward turns, you were doing stretching turns, so forward back for a while?
Yep, because I had a piezo release, so I wanted to, give that time to heal up, and have that healing process start before actually, separating the bones.
Yeah, this is actually a good point to segue into our Q&A if you want, because we have a question specifically about stretching turns.
Yeah.
Are you good to answer some questions
Yeah,
that
let's
chat
do it.
has for you? Okay,
Yeah.
sweet. So that nice segue question is somebody says, can you explain stretching turns and the benefits? My ortho doesn't believe in them and says it confuses the cells.
Oh, well, I didn't know cells could be confused, but that's good to know. Yeah, so, stretching turns, I've done a whole, video on it on my YouTube channel you can check out, on the Vegas Orthodox channel. I believe it's called, like, FCPC. You can watch the video, you can, look at the articles, that were originally published for the protocol. And then there's one on my other YouTube channel, Hamilton and Manuele, that kind of explains how to do it as a patient. So check those out. But the long story short, essentially what stretching turns are doing is they are putting a controlled force that is slightly higher on the bones for a shorter amount of time. And then that force is released. And it's done, a couple times a day, or at least once a day. And so the theory or the thinking is over time, as you're doing these stretching turns, you're allowing the bone more time to remodel and adapt. All right. So, I mean, it's almost like, you think of like a piece of wood or something. If you were, just bending a piece of wood and you keep bending it in the same direction, eventually it might be more likely to just snap, right? Whereas if you bend it a little bit, then you let it relax, then you bend it a little bit and you let it relax. I mean, kind of like, what happens like in the wind, right? I mean, like, like trees go back and forth, and they become, a little bit more elastic in that way. And so, not to say that bone is wood, but that's the best comparison I can come up with is that, as those forces are placed on the skull, it gives the body time to adapt and remodel in a way that, in my opinion, makes the bones more elastic and less likely to fracture or break during the expansion process. And so, we want all of the sutures to mobilize and be elastic, but we don't want any one of them to break completely and have a complication where you have like an unwanted fracture somewhere. Additionally, I found that the initial split of the expansion process tends to happen a lot more predictably and a lot earlier with patients who are really good at their stretching turns. So, yeah.
Does it seem to lessen the asymmetrical expansion in what
So,
you've seen?
So yes and no, right? So if indeed it does reduce the incidence of unwanted fracture, then it's going to eliminate any cases that would have had an unwanted fracture that would have resulted in asymmetry. But that being said, like just an asymmetry in the absence of a complication or an unwanted fracture, most of the time that is due to either the design of the expander, not designed in the way that it needed to be in order to facilitate even bone movement, um, or unseen or unpredictable resistance of the bone and the sutures, meaning like the expander looked like it was designed fine, but for whatever reason, there was less resistance on one side than the other, and one side, expanded faster or more than the other side. So yeah, there. You can never predict everything 100%. So we do our best to take a good look at everything. I was tracing out a case today where we had set the expander, 2 degrees more inferior, which is quite significant in order to correct a cant. And when we traced it all the way out, well, the good news is the cant didn't get worse, but really, we probably could have gone 3 degrees. We probably could have gone a
Mm,
little bit more because the expansion was kind of completely level, but definitely, we were trying to even correct it with the
mhm.
expander, and we just got even expansion. We didn't necessarily get a correction of the cant. Um, so yeah, we're still learning as far as what because other patients you do the same thing and you do correct the cant. And so, there's definitely a lot that goes into that we don't fully understand as it relates to how the expanders need to be set up to get, perfectly predictable movement. Um, my expander, and again, we've only expanded, 1 millimeter so far, but mine is set to bring my left side of my jaw down relative more to the right. And I think what Phasegenics told me is that like mine is the first that we've done that on, right? With an FME, right? So I mean, we do it with custom RPs and MSEs all the time. So it will be interesting as we continue to expand to see if that predictability of that left side coming down more than the right side starts to show up. I didn't really see anything noticeable in 1 millimeter. But once we get to 3 or 4 millimeters, if that's going to play out, we should definitely see it on the superimpositions.
So you're attempting to fix a cant on yourself.
So I
Can
mean,
you
I
point
don't.
to your left side?
Yeah, so, like, the left side here, if you look,
Got it.
yeah, it's just a little bit higher up than the right side,
Yeah.
and as that expands, we should see this tooth drop down a little bit more, and we should see a leveling of the arch, as that happens, so time will tell. A little too early right now.
Yeah, so interesting about that 2-degree, tilt, and then it just resulting in a neutral expansion.
Mhm.
Kinda similar to, what Dr. Nuaz and I are trying to figure out with my yod case and how we're gonna correct it. So it's kinda good to know. One more question about the stretching turns is who actually came up with that, and when was it implemented first?
Yeah, I'd have to go back and look at the, release date on the study. I wanna say 2023, and I believe Hans Windhauer, who's an orthodontist over in Europe, I believe was the first one to publish on it. You can fact check me on that, but, yeah, it was published over in Europe. And what's interesting about Europe is they use they in general lean more toward non-tooth supported expansion systems completely. So there's a system called the benefit system that they use. And so the TADs or the screws are a little bit larger in diameter. And so when I initially researched what they were doing over there, it was quite impressive in a lot of ways. And the failure rates in general are higher. So that was kind of like the thing that was not as good is that that there were more failures, but the cases that they were successful in were impressive. Like cases where we typically design 6 or 8 TADs. I mean, they were expanding with 4 TADs. And so I was like, wow, okay, so that's pretty impressive. Like, how are they doing that? And then start to dig into the system that they published as far as the turns go, and that's where that functional FCPC, functional polycyclic cycling, and there's a whole protocol, and I don't follow that protocol exactly because it honestly it's quite difficult to emulate in private practice. They have a force gauge, and you have to have a key that's the same length in order to determine the appropriate amount of force. And then, so yeah, I mean, it's very very technical the way that they published it. Um, and so we try to keep it as simple as possible. So really, it's like with stretching turns, if they feel too hard, they're probably too hard, right? So don't put like too much force on your jaw, right? You
Right.
shouldn't be, you know, having your finger muscles get sore trying to do your stretching turns. But as you do it consistently, you'll notice that the pressures required to turn go down. And so that is what you're aiming for. You want to do the stretching turns enough that your turning forces are low enough that you are able to turn the expander more easily. And again, kind of reduce the resistance of the whole system so that your expansion can be hopefully as pain free and predictable as possible. That's one other thing I have noticed. Prior to implementing the functional turning protocol, I would more often have patients really notice their split when it happens. So they'll feel it; they'll feel like a tearing or like a ripping, and not everybody, but more often than not, I can't think of a patient who's done stretching turns where they felt that definitive rip. And my case is a perfect example. Like I didn't even know I split. Like I remember talking about that with you guys. I'm like, I mean, it doesn't even seem like I split, but I mean, I'm pretty sure I did as soon as I got the gap. But I wasn't really believing it because I didn't really feel anything. But I think that that's kind of more how it is. Like when you do these stretching turns, you might feel pressure other places, but there really wasn't any sort of definitive resistance left by time it actually opened up. Um, and so yeah, it's interesting for sure.
What did you call it? What was the term? Functional turning
Yeah,
protocol?
functional polycyclic cycling, or FCPC, something like that. Yeah.
Got it. All right. Thanks for bringing that down. So next question. Can you tell us what you know about hearing loss in relation to expanders and particularly FME? It's on the Phasegenics form about potential hearing loss with expanders. and I'm getting nervous. Is it uncommon? Is it temporary or permanent? Has it happened for FME or just other MARPs? Has it happened with the slow turning protocols, or was it because of turning too fast? Is it full hearing loss or muffling? And just so you know, I have heard this come up a lot in patients. So that one, and then the eye sight stuff. So I know we're not
Mhm.
talking about eyesight, but this was had a lot of questions in the question, but know that like a lot of people are asking the same thing.
Yeah. So, with any type of MARP, FME included, I've never had a patient, report or experience hearing loss. And so, um, in fact, well, let's back up a little bit. So there's hearing loss, but then there's also tinnitus, right? And
Mhm.
so, like, patients experience tinnitus that is related to their jaws and their function, whether they expand or not. So some patients come in, and that's one of their chief concerns. It's like, hey, I have this ringing in my ears, and I didn't used to have it, and something happened to my bite, and then now I have it. And whether it's expansion or whether it's just orthodontics to correct the bite, when you some forms of tinnitus are caused by inflammation in the jaw joint, which is very close to the ears, and it basically has some feedback or whatever you want to call it. The inflammation in the jaw joint tends to refer or have this associated symptom of tinnitus. And so in those cases, like when we expand or when we just align the bite or whatever we need to do to get the bite aligned to reduce the inflammation in the jaw joint, then things like tinnitus can go away. Now, as far as it causing hearing loss, so it's on their consent. I mean, I'm sure there's a lot of stuff on the consent, right? Now, how could it cause hearing loss? I mean, I don't know. I mean, obviously, the whole mid face is moving. I would have to, like I say, I haven't seen or superimposed an image that had a patient who had hearing loss. Again, I haven't heard about it personally. Nobody who's done consults with me have reported hearing losses, or the online, consults or superpositions. So I'm not sure. Certainly when you're moving the facial bones, there are unpredictable things that can happen. The vision, we did an interview on jaw hacks for the vision complication on the last interview that we did, and that seemed to in my opinion, be most related to the amount of turns that were done in a very short amount of time.
Mm.
So basically, the loading of that expander caused a very rapid movement of the orbit, and in general, it seems as though the midface, if it's moved at a slow enough rate, the risk of all of these things goes way down. And so again, that's why I always tell my patients like you should never be pushing it, right? I mean, like if you feel like you're turning too hard, you're probably turning too hard. And you need to spend more time stretching and waiting until those pressures reduce so that you can have the expansion without having to increase the force to levels where, in my opinion, the risk increases.
So it sounds like it's not very common in
Yeah,
what you've seen.
I've never seen or heard of it on any of
Right.
my own patients or on any of the patients I've consulted with. None of them have reported hearing loss after expansion. Yeah.
Yeah, and I can say I'm somebody who got vertigo with MSE, and it was temporary. It happened towards the end of expansion, and then once I put braces on and started moving my molars and everything, it felt like it was a molar kind of issue, especially with the arms of that device. Um, it all went away, but I got like worsening tinnitus and then vertigo, but it was temporary. So hopefully
And that makes
that
sense.
holds.
Yeah, so when you expand, I mean, the bite is changing, right? And
Mhm.
for a while, the bite is going to be worse than it was to start with. So, when I have patients who experience any sort of bite related issues, it might be, pain in the chewing muscles or whatnot. We tend to put them into what's called an in-mouth bite splint, where we basically provide them pads on their teeth to bite onto instead of having the teeth hitting together, and
Mhm.
that can take the stress off of the jaw joint. And, so if they were, let's just say they were to develop tinnitus while we were expanding, you could add a bite splint to stabilize the joint while the expansion process is happening. So yeah, I mean, but hearing loss, I mean, like certainly permanent hearing loss. Yeah, that to me, um, yeah, I've never seen it, and I wouldn't have a good reason or explanation if that has happened to people, like why you would have permanent hearing loss. I would have to ask somebody that's had it or look at it like what the mechanism is there. I've never heard of that. So yeah.
Yeah, my best guess would be there was already some initial issue to begin with, and I would say for my vertigo and the tinnitus, I already had like a right side TMJ issue, and so it
Yeah.
seems to have
worse.
exacerbated that while I
Yeah,
was
that
expanding.
makes sense. Yeah, with the
That would be my
diaphragm.
best guess for somebody that experiences hearing loss. So let's move on. Somebody has a protraction question with the headgear. They say, I plan to get an FME Pro, but I'd like to protract with it since the FMA is not available. Is it possible to make a custom wire with hooks at the end so it can be connected to an FME?
Um, so is it possible? I mean, sure, the device itself has little inlets that are designed for the protraction FME to hook up to it. So there's little holes in the back of the FME that accept a wire. Now, as far as how you're going to go about making that wire, yeah, I mean, like I don't know. Yeah, I mean, you'd have to somehow get a scan of it and then try to have something metal 3D printed or wire bent or something. So I'm sure that if you're good enough with engineering and the mechanical side of it, you could probably do it. I'm just waiting for FME. So or
The
yeah,
FMA. Well,
yeah.
have you heard there is a patient who did that. They had a custom 3D one printed up a couple of times before they got it right. And I think they have been sharing their plans with how they made it, and it's specifically for the FME. Um,
There you go. I mean,
yeah.
use at your own risk.
Yeah.
Mm.
Okay, so next question sounds like potentially an allergy question. Somebody's asking, does the FME contain any nickel, cobalt, or chromium, or is it all titanium, including the tabs and screws?
My understanding is that it's all titanium. Yeah. So, I mean, I like I said, I don't speak for the company, and I'm not privy to any major insider information on materials. But my understanding is that it's entirely titanium. So,
So is that
yeah.
the same with the Marpy?
No, so MARPs are typically cobalt chromium.
Mm.
I know that there's one lab in Europe that recently developed an all titanium MARPy. I want to say Partners has been working on one for a while. I don't think that's commercially available yet. Um, so yeah, most of the MARPys, custom MARPys, are cobalt chromium.
So what would be the benefit of doing all titanium besides like the weight of it?
Well, one benefit is MRIs. If you ever have an MRI or you need an
Oh.
MRI during the process, something comes up. Cobalt chromium can cause a lot of scatter, and or depending on what they need to MRI, if it's the head, that you might not even be able to do it. So that's one thing. Again, that's a small subset of patients, but can be important. Also, the mechanical properties of titanium are different than cobalt chromium, and I can't say one is better than the other. But essentially, and this is something that was interesting. I don't think I've really talked about this yet, but when I first got a split, I stopped my forward turns because I wanted to start my aligners, but then I went on vacation for a week, and so I didn't get around to starting my aligners, and I just kept doing my stretching turns. And from the time I split until the time I was back on vacation, even though I wasn't doing forward turns, the gap opened up like another 3/4 of a millimeter. And so essentially, the only thing I can really attribute to that, or that would explain that, is the we'll call it elastic properties of titanium, essentially. So, basically the force in the system was building up, building up, building up, building up. Then the suture released, and there was a lot of unexpressed energy, so to speak, in the FME itself, and so it almost kind of uprighted or I guess I don't know, bent or rebounded, so that it was actually still kind of expanding, even though I wasn't turning forward at that moment. So whether that's a pro or a con, like I don't really know, but it was kind of interesting. I mean, in my best opinion and estimation, that probably is a pro. Because if it has a little bit of elastic deformation, that means that as you go, you have less of a tendency for brute force to cause maybe something that you don't want it to, right? So even if you did overturn it just a little bit, you might have some elastic deformation, but in a way that there's memory, right? So eventually that can upright again, when the forces are lower. So, yeah, that's pure speculation. I've got nothing to really back that up or prove it, but that was kind of interesting, something that I experienced. That's the only way I can really describe it or explain it. So, yeah.
Okay, moving on. We have another person in the chat wondering if I have a narrow palate, but I also had my wisdom teeth grow in to 90%, and they're not sideways, but I believe they're impacted in the back of my airway. Can expansion move forward enough to do it all, or will I likely need surgery to expand forwards to compensate the teeth?
I mean, I mean, without seeing records, obviously, it's really hard to give an opinion on that. But if the wisdom tooth is really 90% in, almost certainly you could get the last millimeter or 10% of uncovering of the wisdom tooth with 4+ millimeters of expansion. That I would guess would be plenty. Again, without seeing your case, I don't know how much expansion you need or whatnot, and or if it would be indicated. But yeah, if they're already 90% in, I would guess expansion would probably take you the rest of the way to where you didn't have to remove them or have them remain covered up. So yeah.
Jumping off that question, so one topic that is brought up a lot in the Facebook expansion group is about wisdom teeth and expansion. And I have heard varying perspectives from different doctors. And it seems like the general consensus is expansion cannot provide enough width in the arch for wisdom teeth. Because doctors have said expansion is generally impacting the anterior portion of the arch. So is that mostly true?
I would well, I don't think you can make that general of a statement, truthfully.
Okay.
So it really depends, right? So a patient that needs, 2 centimeters of expansion, like 20 millimeters of expansion, I mean, that's a lot, right? But I've had patients that need that. And so, that's essentially if that space is managed correctly, that's pulling the teeth forward 10 millimeters. That's almost per side. That's almost an entire tooth. Yeah. So, can it make the difference? Sure. In some cases, it can. Now, basically, how much room you're going to get, essentially divide the amount of expansion you get by two, and that's how much potential forward movement you have of the upper teeth if managed that way. If your teeth are tipped back to start, you may have even more room to bring the molars forward if those teeth are then brought forward where they need to be. So there's lots of different ways to manage the space that you get. If your teeth are already in the right position in the front, then you can move the back teeth forward, basically half of the amount that you expand. So if you expand 5 millimeters, you'll get about 2.5 millimeters in the back if your orthodontist designs it that way and brings those teeth forward mechanically. So yeah, I mean, is that, most patients say, I mean, the vast majority of patients need between 5 and 10 millimeters of expansion, let's say. And so, if you're getting 5 to 10 millimeters, that means you're getting 2.5 to 5 millimeters per side of potential movement forward. Is that enough for wisdom teeth? No, not if they're completely blocked out, right? But if they're already, if you have half enough room and then you just need half more, well, maybe that would be enough. So yeah,
Okay. Okay, got it. So it sounds like in general, not fully enough space for what we need for wisdom teeth, especially if they're impacted, like a lot of us.
right,
But in specific cases, it can provide enough.
right, right.
Okay.
How are we doing on
Next question.
time?
Looks like we got 5 minutes. I was going to try and plow through these last few questions if we can. You guys ready?
Do it. Let's do
Yeah.
it.
Okay. Does the fact that custom RP tend to expand one side more than the other happen often? And is this eliminated with FME?
Yeah. So, that's a question that we are constantly asking, right? And so, every single case that we do that we look at, we're trying to answer that question, how symmetrical is one type of expansion compared to another type of expansion? And we have custom RP cases that expand beautifully and symmetrically, and like really you can't tell the difference between some of them and FMEs. And then there are others that are much different. So all I can say at this point is that anecdotally, what I see, what I experience, I tend to see more symmetrical, meaning right and left, expanding the same amount, and less asymmetry with the FME cases that I'm doing. But again, like quantity wise, I have done a lot less FMEs than I have custom RPs, right? So we need more data. Is the short answer to that. Hopefully, ideally, whether it's FME or a new company or whatever, like that's always the goal. That should be the goal for all of our expansion systems is designing it in a way where the expansion is as symmetric as possible and the chance for asymmetry is as low as possible. So again, time will tell. The more of these cases we do, the more we trace out. My guess is that due to the dimensional stability of the FME, I do think we'll see more symmetrical expansion and less asymmetries. and more parallelism with the expansion. But I don't have enough data to really quantify that or say that definitively. But that's my gut based on what I've seen so far. And that's honestly, truthfully, why I got the FME myself, right? I mean, I could have done a custom Marpy,
Marpy.
years ago. In fact, I actually did order a custom Marpy for myself 2 years ago and just never ended up placing it. And so, like at this point with the way that the expander's designed, like I was like, okay, I'm gonna jump in and do it. So yeah.
Okay. Next question. Is it a good idea to have a professional cleaning the day before FME installation to minimize infection risk, or will that just cause cuts and tooth sensitivity?
Um, I I I don't. I mean, honestly, I don't know if there's much data to support that one way or the other. I mean, it's always a good idea to get your teeth cleaned. So, I mean, I wouldn't not do it. Whether it's the day before, is it going to really reduce your risk? Probably not. I mean, with that, you just want to make sure that of course, your provider is following standard of care. You do a pre-rinse, all that kind of stuff. To mitigate risk of infection and things like that. I don't know that the cleaning the day before will really move the needle on that.
Yeah, I think I did mine maybe like a week or two before just to get it done and be ready.
Yeah.
All right, next question. Is pterygoid suture disarticulation linear to forward movement, and what is the relationship between the two?
Let's see. Yeah. So let's. Hold on a second. I'm gonna pull up one other thing real quick because we get that question a lot. Um, about pterygoid disarticulation. The short answer to the question is the pterygoids tend to disarticulate just fine without being released in the vast majority of cases, whether that's complete disarticulation or bending outward. And if you look closely at the superimpositions that we did on mine as well, and hang on, I'm going to find the right one and then I'm going to share this with you guys.
Okay.
You'll notice that even at 1 millimeter of expansion, you can already see movement of the pterygoid plates. Let me see where I put that. I don't know if I can find that one. If I can't, let's see. Oh, let me just show you that other one then. Yeah. So yeah, the short answer is they do tend to disarticulate quite well. So this is the let's see, let's take out of here. All right. So looking here, so this is the lateral pterygoid plate, and you can see the movement of the pterygoid along with the movement of the maxilla. So again, and we look at the quantity. We have about 1 millimeter or so of expansion happening, and we already have about a 0.5 millimeter per side of disarticulation of the, or not necessarily disarticulation, but of bending or movement of the pterygoid plate at the same time. So with larger amounts of expansion, we tend to see the maxilla pull away from the pterygoid plates, and that's something that we commonly see. So I like I say, I don't believe that that you need to release the pterygoid plates. I don't know that it's necessarily beneficial. I do think that there is a fair amount of risk, and if they're not released symmetrically, that could open up problems that you wouldn't have had otherwise. And then the last point on that is that again, like if you release too much too soon and you turn too much too soon, again, you open yourself up to the bones moving so fast that the rest of the face and skull can't really adjust. And I think that's when those more serious complications tend to show up. At least on the cases that I've reviewed, the most serious complications tend to be patients who've had very very aggressive releases and or very very aggressive turning protocols, and the worst is the combination between those two. So yeah.
All right. Well, awesome. We'll wrap it up here and save the other questions for later. We have a little backlog, so maybe one time we should come on and do another Q&A because people seem to really like that. I can't wait to see next call your how you've evolved with your FME journey.
You're
What
gonna
turn are
look
you
pretty
on right now?
good. Oh, I have no idea actually. So
Oh, I think you said
I,
that just
yeah,
because of all
yeah,
the
I've been
stretching
I've been the
turning.
worst patient as far as tracking turns, but I mean, obviously, like I'm monitoring what the bones are doing, what the teeth are doing. I'm updating imaging. I'm looking at the expander. So, I'm not counting my turns, but yeah,
And do you have a goal of how wide you're going for?
yeah. So when when we target. I'm sorry, I'm going to move this thing so I can pull it up real quick. So essentially, the I always have a couple millimeter target on what expansion looks like. So my jaws, I'm looking at the measurements now. My upper jaw is about 46 millimeters. My lower jaw is about 47 at the level of the first molars where we measure. And so, ideally upper jaw 3 to 5 millimeters wider. So I've got a millimeter to get them even, and then another 3 to 5 millimeters. So I'm targeting, 4 to 6 millimeters of expansion.
Okay.
So, and if I get to 4 and breathing's great and, everything's, looking and feeling good, I'll probably stop there. Or if I feel like, I'm consistently feeling better with more movement, then I might go to 6 millimeters. So we'll see. But like I say, right now I'm probably at about 2, a little bit more than I was a couple weeks ago. Or at least, maybe like 1 3/4 or something if I had to guess where I'm at right
Okay.
now. So yeah, yeah, but no, next month I'm sure that things are going to start. The front teeth tend to tip
Closing.
it, right? Yeah.
So can we
So
see your gap one last time before it goes bye-bye? Awesome. Yeah, people like you with the gap.
well, yeah, well, most of the time I have that aligner in, and it kind of it does actually. That's I guess something we could talk about. So when you put the aligner in, it does make the gap quite a bit less noticeable. So speech is harder because you then have the expander and the aligners you have to speak with, but it does make the gap a little bit less noticeable. And yeah, the other thing that we're trying or doing, like with my case, I don't have any attachments on my teeth. So these are thermodynamic aligners. They're shape.
Oh, yeah.
So they're direct printed. So basically, when we use these aligners, we put them in hot water, at night, and sometimes even multiple times throughout the day. And when you do that, it restores the force of the aligner. And because they're 3D printed, it can engage all of the undercuts of the teeth. And so it allows a better grip on the teeth without as many attachments. So I might need to add attachments to the aligner in order to. I'll take that out now.
Wait, I saw some of your little surgery blood coming through.
Yeah, exactly. I wasn't wearing it to start with, but I I might have to add attachments to the teeth to get everything finished at the end. But for now, I'm going to see how much movement we can get without any attachments. So yeah,
Awesome. Yeah, these shape memory liners sound pretty cool, especially for somebody who's had a gazillion attachments and braces. I'm worried about enamel coming off
yeah, yeah.
eventually.
No, no.
Um,
I mean, obviously the polishing is insignificant, but no one loves attachments. So if we can do it without, it's better for everybody. So yeah,
well, sweet. Thanks, Dr. J. I love seeing your journey, your FME journey. I love when a doctor has an expander. It's just always so great. And then thanks for answering all the questions. We'll see you next time.
sounds good. We'll see you guys.
All right. Bye, everyone.